Dr. Justin Moody and Dr. Mike Frymouth are two outstanding guys that are exceptional general dentists. They've done exceptional things in their private practice offices. They're humble, they're super trained from the prosthetic end to the surgical end, and all they're doing is trying to, and what, through this Implant Pathway course, is tell all these guys what it's taken them 20 to 30 years to learn, and they're giving them in a couple weeks.
It's just a great hands-on experience. Also, I think a big part of it is just getting to know other doctors that have experience, and other doctors that don't have experience, and just learning from everybody, and just getting excited about placing them.
You got somebody holding your hand while you're placing implants, and so I feel like that's the fastest way to get confident. Someone over your shoulder, making sure you don't make a mistake. But even to a greater point is, since I've been here, a few mistakes have been made, but it's just amazing to learn how to fix them. And that's the biggest key to it. When you have a complication, how do you address it? And that's what this course provides.
I need a certain level of confidence before I can sit across from a patient and present a treatment plan to them where I need to do X, Y, and Z. So for me, there is no substitute for a live patient surgery course. There's plenty of weekend courses out there and a lot of talented instructors that teach them, but until you do it on a patient, with saliva and blood and all the rest of it, it really instills that confidence for me that I need to be able to go back home and employ these techniques that I've learned.
Everybody I've talked to talks about a study club and the webinars and getting just having access to someone who's willing to share their knowledge about the tools, armamentarium we use, the implants, the practices and procedures. It's very difficult to do that without some mentors along the way.
You have to get in there and do it. You can read all you want about it. These guys do a very nice job of laying out a basic game plan, keep it simple, and then we have instructors in the room, and it helps.
They are really enthusiastic about what they do, and their enthusiasm translates to the other doctors. And so they guide you step by step. They're not intimidating, and they're really amazing.
They have the experience to teach you, because implant placement is not the complicated part. It's knowing what to do when things don't necessarily go right. And so when you can pull from that experience and learn different techniques, it allows everything to run smoother. They bring a lot to the table from their experience that they can teach to you to be able to take back to your practice to succeed.
It's been absolutely unbelievable. The way I would describe it is Make-A-Wish program. I got my wish. I got to put blade implants in, which is something I thought I'd only get to see in textbooks, but to actually get to be there and to help improve the quality of life for the patient who had almost no ridge and to increase their width. It was probably one of the most exciting days. That was yesterday. And then today, 2 lateral sinus lifts. Oh my goodness. I couldn't be any happier.